Hi everyone, my name is Dylan Grant, and I hope at this time you're able to review the overview of my experience here in Canada. It just gave you a quick insight of my journey here with discrimination within this country. I gave you from start to finish in that overview. However, there was not much details, right? I'm going to try my best to go through the details now. I'm going to go fast. If you wish, please pause and read if I'm going too fast, okay? So here, for 2016 to cover for the discrimination of Bell Mobility and MANULIFE insurance. I was fired from my job of 20 years without severance pay and with a work-related injury. The lawyers and doctors in Canada joined forces to have the Ministry of Health distort my medical health records. I'm not making up stories. I'm not making up stories. I sometimes have to pinch myself if I'm really, is this real for real or am I in a dream? I did not expect this at all. Okay, just to cover up for two large entities here, Bell Mobility and MANULIFE. They are big entities here in Canada. Okay, here it shows it's a medical history to the distorted medical records from just to show you the history where I'm coming from. This information is from Dr. Erin Boynton. She was instrumental in allowing me to lose my job. Yes, her report was biased. However, she did start out right. She said, Miss Grant is healthy. As you can see, this is my medical history. And she denied a history of fracture. She didn't ask me anything, I guess. From my medical report in 2016, she noticed that I didn't have any, say, complaints. I'm healthy. And I didn't have any history of fracture. Not sure why she put that. Okay. And I did not have any joint symptoms. Okay. That's there. Okay. Please feel free to pause and read if you wish. Okay. Thank you. And this was a medical record from the Ministry of Health and Long-Term Care. It's located in Kingston, Ontario. As you can see here, here's the address. And it says Ministry of Long-Term Care. All right, I got this. It was dated March 22nd, but I got it in April 2019. There, it was dated March 22nd, 2019. I got it in April 2019. It was requested by the long-term disability lawyer Benjamin Law Firm. It was requested, but thank God, whenever a lawyer requests a report of this nature, understand it has to come to the person's address. So thank God it came to my address. When I opened it and was going through, I was wondering if they provided the wrong report. Honestly, okay. Please feel free to pause and read. And here is, I'm just showing this. This is just a page of the many from the Ministry of Health, and I'll be going through. Okay, as you can see. All right, I'll be going through. Thank you. That's my name there, Dylan Grant. Okay, and this report is from 2014 to 2019. Okay, thank you. Here it says on September 3rd, okay, I was diagnosed with decovin tenosynovitis. I went to Great Lakes Medical, and yes, I got a work-related injury, and on this date, September 3rd, I was diagnosed with decovin tenosynovitis, as you can see. The Ministry of Health indicated instead on 3rd of September 2016, signs, symptoms not yet diagnosed. I think that's diagnosed. Musculoskeletal system leg. This code is the wrong code. The code is supposed to be 727. All from my injury, all codes supposed to be 727. Tenosynovitis. There are various diagnoses here, but mine was tenosynovitis. So here it is, 727. But they chose to put 781. Okay? I guess they have a reason. Please pay close attention to this. There are others I'll be going through, all right, on my next slide. Okay, work, this, as I made mention, this is a work-related injury. The previous diagnosis was from a walk-in clinic, and that confirmed there could be tendinitis. I went to my doctor's office on it was not it was not at his office, it was at the hospital. He was not at his office, he was at the hospital. So I went there to see my doctor, Dr. James Chang, and he confirmed tendinitis, and he made mention from excessive typing, and she will be required modified work with appropriate therapy. She will likely need a break for a few months or more. Okay, never heard of this thing before. Tendinitis, Decrovane. Okay, I always heard of carpal tunnel and all that, but never heard of this before. So I was diagnosed with this. Okay, this was my 3rd month. Luckily, so on October 5th and October 17th, 2016, you can see that. You see, we already have the 3rd of September. Now I have the 5th of October and the 17th of October 2016. Great Lake Medical I'd indicated that I have Decrovane syndrome, right? The medical records from the Ministry of Health indicated, for as per the dates, see, October 5th, 2016, October 5th, okay, indicated Dupuytren's contracture. And then October 17, 2016, Dupuytren's contractor. You can see that, all right? Luckily, a lot has been going on, and I tell you, I decided to go to Great Lakes to ask for my medical report, and they refused to give it to me anyway. I got all a run around, but eventually I got a letter. I said, just give me a letter with all the days that I came to your clinic, and thank God I have it here. Yes. So I did this, got it. So everything here is regarding Decrovane syndrome. It says the above named patient was seen on the following dates. Okay. So anything else other than Decrovane syndrome, definitely is false. Okay. So this is false. My medical record was tampered with. Okay. And I will get to the reason. All right. As I go along. Here again, you have 727. So these were the correct codes. Anything else outside of 727 is incorrect. All right. Thank you. This is what Dupuytren's contractor looks like. And this is what I had. Tendinitis. They call it tendinitis for short. Yeah. Swelling in my tendons here. Okay. Please feel free to pause and review. What happened? Here's a brief history of my right hand injury at work, bell mobility, in 2016, okay? This was, I told my supervisor when I was moved to a different desk, and I will get to that reason in another presentation. I was maliciously moved to a desk with broken tools. Bell was trying to frustrate me. Yes. I moved to a desk, and the desk wasn't accommodating at all. So I told my supervisor, he did nothing. So this was my 2nd time telling him, and I put it in writing this time, because a few days went by, and I told him there's no lighting at my desk. My desk area was dark, right? Depressing. Keyboard I need replacement, right? It was broken, foot was broken. There was no lamp. I'm supposed to have like a lamp. Since long story, I need lighting at my desk, okay? And yeah, I told him, and nothing. Then this was my 3rd time telling him this was May, May 2016. I told him again, the latter part of May, 3rd time. This was the 3rd time, okay? And then a month later, this one is June. I actually told him the 4th time, and nothing was done, okay? My hand was now in pain in June, and I told him, and he did nothing, okay? My injury I tried to get up in July. Actually, my hand became swollen. My hand became swollen. My coworkers were even alarmed by that, because it's like, what's going on? Um, so I tried to get an appointment for my at my doctor's office, and I got the appointment for August 8th. So my injury was in its third month, 7 weeks and 5 days, 54 days old, June 15, um, to August 8, 2016, when I saw my family doctor, Dr. James Chang. I was misdiagnosed by my doctor and went back, who sent me back to work, right, to use my painful swollen right hand. I was told by Dr. James Chang to wear a wrist brace at nights, to use extra Voltaren cream, and that I would recover in 6 weeks. Now, as I said, 54 days old. Okay, and I was sent back. Here is proof. As he had made mention in one of his report, this patient was initially seen August 8, 2016, for pain and tenderness, right thumb and area and all that, right? Not making up stories. I was sent back to work. I went back, okay? No accommodation, June 15, 2016 to September 7, 2016. My injury was 12 weeks old. I was allowed by my supervisor by mobility to work in my condition. Yeah. Due to sleepless nights in pain, right hand swollen since July, I was told by a walk-in clinic doctor in September 2016 to cease typing. That was on September 3rd, 2016. When I went to the walk-in clinic, it was a Saturday. And then the doctor took time out to question me to get to the bottom of it. And then he said, oh, cease typing. It's Decrovin tendinovitis. Okay. All right. Here, I was off work now on September 7th, as of September 7th. And I took a picture here, September 28, 2016. Here's a rash, burnt rash on my hand from the extra strength Voltaren cream. I had an allergic reaction. From the cream, and so I'm showing you here, this is rash from the cream, and my hand is swollen right up to my elbow, and I was in pain, sleepless nights. Can you imagine? Yeah. Okay, please review. The reason why I think they are distorting my medical records, okay, they have distorted, that is. It says here, I'll read this. It says the symptoms of tendinitis generally begin with pain and possible swelling. So my pain originated in June and the swelling in July of 2016. Okay, possible swelling. Symptoms in typical mild cases when treated quickly and with no other complicating factors. You see this section here? No other complicating factors. So they're trying to mess up my medical report to say I had other complicating factors. So it cannot be work-related. How malicious, eh? Okay. All right. Then it says, when treated quickly and with no other complicating factors, dissipate in a couple of weeks. However, healing time can sometimes take weeks, months, or a year. All right? Please feel free to read if you like. Okay? My doctor, Dr. James Chang, did not send me for any testing at all. No. Neither for physio. No. I was the one who went to Great Lakes Medical Clinic, again, the walk-in clinic, and the doctor chose to send me for an ultrasound, all right, ultrasound of my right hand, in October. So here it says October 11, 2016, okay, and ultrasound confirmed the tendinovitis. There it is, in keeping with tendinovitis, whatever the information here. Please feel free to read, okay? I was the one in October who had to go to my doctor, Dr. James Chang, and ask if I could, while I'm waiting to see a specialist, while I was waiting to see a specialist, I didn't want to sit around, you know. I don't think my company or the insurance company want me to sit around waiting on a specialist and not doing anything. So I was the one who went to my doctor and said, could I do physio in the meantime I wait? That's what I asked my doctor. I was the one who was being proactive. I was the one, I want to get better, eh? So few attempts, a few times I called and went in office, and my doctor said he was unsuccessful in getting a specialist. Here it shows referred to Dr. Handelsman, and this was in December. On December 13, 2016, I went to my doctor's office, and then that's when he said, oh, we got a specialist, okay? The appointment was made for January 26, 2017, and that I will have to wait now 4 months since my injury. 4 months since, actually, no, 4 months since I was off work. I had to wait, right, to see a specialist. And here, as I enlarged, I did say here that my doctor made mention that that I had tenosynovitis, and I'm on physio, and there's no improvement. All right, December 13, 2016. So that's the history of my hand. 6 months later, from June to December, my hand was still in pain and swollen. Physio at this point in time could not help me at all. All right, please feel free to review. And I will go on to another presentation which contains 2017. Thank you for your time.